Actually, I started in 1973. I was under PCHA, People Community Hospital Association. 1973, we were on functional nursing. One nurse passing medication, one nurse taking charge of 30 patients. I moved here in 1978 and worked in IMC, which is intermediate care. We were on primary nursing. We have no aides, no orderlies, all nurses. Because my friend was the manager there, so she talked me into working with her. I moved up to medical surgical because somebody invited me to be there. I enjoyed my company, my fellow nurses, CNAs, orderlies. We used to have orderlies, and we worked together as a team. But before that, I worked ICU. One of my patients was in bad shape. I took care of him. He did very well. He went home, but before he did, he asked me, "What does Estrella means?" And I said, "In my country, it means star." And he said, "Well, you are my star and my angel." And since then, I was called by everybody star. So at Heritage Hospital, I've been here for 35 years total. And I've been a star since then.
Star is the star of my unit. What I value about Star is her integrity and professionalism. And her and I, we have been friends for a couple of years now, and I love working with Star. And also, I have lots of new grad nurses who love Star because she is like their mentor. She's their role model. I round every day on patient, and every day her name comes up and they tell me how wonderful she is.
I have worked with Star for 13, 14 years now. She basically was one of the people that actually orientated me when I first started here 13 years ago. She's very, very knowledgeable, very smart. Taught me a lot of things that I probably would have never known if it wasn't for her. Personally, she's always been there for somebody that if I had a question about, for anything, with a patient, family member, what to deal with in a situation of patients not doing too good. It was actually when I was only a nurse for only a few months. I walked into the patient's room and I didn't really know what was going on with him. His heart rate was really high. He was kind of lethargic. The wife was there and actually knew her, and she started crying, gave Star a big hug because they knew each other before, and she helped me with that situation. I thought that was pretty, inspiring that she just walked into the room and this family member just started crying, gave her this big hug, and Star's here. And I thought that was pretty nice to see, and everything will be okay. She's here, she was there to help me out during that situation. It's all her knowledge and her generosity to other people that I think would be her legacy, and I would only hope that one day that I could have some of the wealth and knowledge that she's had to be able to give to somebody else.
I've been thinking of retiring. That was when I was 62. But I says, what I'm going to do at all. But I says, oh no, I cannot give up this for a while. I'll see if I can stay until I'm 65.
My aunt worked as a dietary secretary at Seaway, which is now South Shore. And I worked in the cafeteria and the dietary line. I had a wonderful time, just wonderful memories. I started when I was 16 and decided, well, this may be a good job to earn some money and buy my first car, a teal blue Maverick. So that was my goal. And once I got my car, I was off to see the country. And I was making $1.35 an hour. And that was a lot of money because people at that time were making maybe around 50 cents if they were lucky. So I felt pretty honored to do that. And I worked from dietary to plant operations to nursing and administration. In '94, I left Seaway Hospital and worked in the Oakwood Foundation for about 5 years. And then in 1999, Valerie Hendricks approached me and says, you know, I have a position here as CFO. Would you like to come and join us and work in corporate administration? And that's what I've been since 1999. I worked with many phenomenal administrators, directors at Oakwood. One of the things that I've always appreciated was the respect and trust we had for one another, and allowing me to learn and grow and observe people and still better myself and better my career and go up in the working ranks as I've done. And they've been a wonderful mentor to me, a coach, and how I can accomplish what I need to accomplish.
Well, Maureen and I have worked together for quite a few years now. I think it's been about 7 or 8 years. And I was really excited to have the opportunity to work with her. And with her history, her background, her work ethic, and Maureen has been a real godsend to me relative to helping me to do my job.
I think one of the first occasions with Maureen was when I came to South Shore Seaway as the assistant administrator. And I don't know if she was paraphrasing Steven Spielberg in the Star Wars films, but she looked at me and she said, "You're kind of short for an assistant administrator." And I thought about Luke saving Princess Leia, and Princess Leia looking back at Luke and saying, "You're a little short for a stormtrooper."
Oakwood is a phenomenal place to work, and I sincerely say that because I've been here for so long. Opportunities for growth, that's what's my mainstay. The opportunities were always there for you to seek out a different position, have the flexibility to work in different hospitals. It's very family oriented, very family. The employees, the physicians, the volunteers, they're just wonderful. And you have a family outside of your own personal family. I had both my children at Oakwood at Seaway, and they were part of my work life, hospital life, and career. So every time that they needed a baby in a photo or a child in a doctor's office, we'd call them up. I'd call my mom, and she would dress them up and bring them over, and they were in the photo op. So they had a lot of opportunities to do that, and they really enjoyed it. They enjoyed it a lot because they got to be part of my life right at work. I am very dedicated to my job or to the person that I'm working with or working for. And I think most people know that about me, to the point where sometimes it can make people crazy, but I do like to have things organized.
I would say that there are a lot of things in terms of respect for Maureen, for her talents, and for her as a person. She is professional, she's diligent, she is excellent at what she does, and she has always been there to cover your back. One of the questions we have to respond to in our annual surveys.
I guess it's the trust and the respect. I guess those are my stories to say. There's a lot of trust and respect between me and people that I work with and know.
In my experience, Maureen has really taken the credo and internalized it. She's someone who really strives for excellence in everything that she does.
I think Maureen really embraces the credo. She shows and demonstrates compassion for people. She is respectful.
I'm also a very loyal friend of Oakwood's for being so supportive, and I feel very fortunate to be able to be part of this family.